Hi everyone, my name is Gene Spiritus and I just stepped down as the Chief Medical Officer at the University of California, Irvine after 13 years. The idea about OMyMeds came to me when I took responsibility for overseeing my mom's medication. This is what her medicine cabinet actually looked like. She had congestive heart failure, she had diabetes, she had emphysema. She took 12 medications on a daily basis. In addition to that, she took 3 or 4 of the medicines that were done as an as-needed basis, and in point of fact, she was also on oxygen. Well, how did she manage all of this? Well, she did it with sticky notes. She had a handwritten list of medications, and I can tell you her handwriting was worse than any resident that I've ever seen. She had a medication box. She filled that. She had many of them lying around the house. Despite the fact that she tried all of that, at the end of the day, she would sometimes forget her medicines, she would sometimes stop medicines, and occasionally she would take 2 of the same medicines on the same day. Now, Mom did not suffer from lack of health care. She had 5 physicians, including a cardiologist, a pulmonologist, and an endocrinologist. My 3 sisters, my wife, and a home health aide were there to help her with her medications. I can tell you that neither her doctors nor I or my family members could ever figure out what her medication list really was on any given day. Now, I know that there are many apps available to me that allow me to develop a medication list. Unfortunately, all of them require me to put in the data and to keep it updated. It won't work and it doesn't solve the problem, nor do text messages or medication bottles that glow or beep. Oni's now going to show you our solution.
Thanks, Gene. So Gene came and looking to me to find solutions that don't require manual updating of medications. Now, I knew that both the pharmacy website has a current and accurate online list. This is a typical online record of a chronic patient, and there's about 20 million Americans whose records look like this. Same as for the insurance company. And you can press on a medication and see some more detail. Unfortunately, this is useless for practically everybody. Nobody's going to sit through this and read all of this. And we thought we can do better. In our vision, when a client goes to his pharmacy or insurance company record, this is what they see. And this is the type of detail that they can have, very straight and to the point. They can have individual reminders, or if they find reminders too annoying, they can generate a calendar that can help them fill their pill boxes or visually aid them in exactly what medication to take at what time. They can look at it online, have it printed out, or even sent by mail, by regular mail. As I scroll to the bottom, you'll see there's ad space. Our customers, which are insurance companies and pharmacies, can use this space to provide coupons to reward behaviors, such as refilling medications on time and so on, help engagement. But that's just the beginning. Another problem that we're tackling is that patients simply stop medications many times when they feel better. And that's because they haven't read and understood what their medications are for. We can generate a very handy cheat sheet that will tell the patients exactly, here's the medication, here's why you're taking it, and here's why it's important to take, even if you feel better. And again, this could be printed out, sent by mail, and used as coupon to reward behavior. There's another cool feature of this platform that we wanted to show you. And so many times users go and seek medical attention, and their doctors ask them, hey, so what medications are you on? And the patients don't know, and that could be very dangerous. We will provide our users with a key tag that they can provide to the doctor. They can just give to the doctor at the time of the visit or an emergency. Now, we know that they can just scan it. We know that most seniors are not on smartphones yet, but we do know that their doctors are. So all a doctor has to do is scan it from our app and get a complete medication list of his patient right in front of him, accurate and current, and anonymized for privacy, of course. There's additional capabilities to this platform. I invite you to booth 50 to continue the conversation.
Thanks, Oni. We know that healthcare is absolutely in turmoil right now. but I can tell you 2 facts that I know for certain. Number 1, people who don't take their medications they're supposed to is a $290 billion a year problem for us. Number 2, patients who follow their medication management as prescribed have better outcomes, fewer rehospitalizations, and less drug-drug interactions. It was important for me to develop a program that was patient-friendly, patient user-friendly, available now, and will be worthwhile in the future regardless of what healthcare looks like. Thank you very much for your time.